or halitosis. If your client has ignored earlier symptoms, he might not seek help until he has dysphagia or an airway obstruction. What is the assessment process for a client with these symptoms? It starts with a careful history and physical, then CBC, WBC, and differential, indirect and direct laryngoscopy, MRI and CT, chest X-ray, a barium swallow, and finally, biopsy. After the cancer is diagnosed and staged, a treatment plan will be recommended, based on the stage of the cancer and the patient's general physical condition. There are several treatments or combinations of treatments for a client with laryngeal cancer, but your goals of care remain the same for each of them. Radiation therapy and excisional laser surgery are primary treatment options for laryngeal cancer, particularly when the tumor is small, or your client may have a partial laryngectomy, a total laryngectomy, radical neck dissection, chemotherapy, analgesic therapy, and/or sedation. As a nurse, your goals of care will include maintaining the airway, observing for bleeding, maintaining adequate nutrition, preventing complications from therapy, relieving pain, and helping to reduce anxiety and fear. A laryngectomy is the removal of part or all of the voice box. It's indicated in the treatment of advanced tumors that have created a large neck mass or airway obstruction, with severe dyspnea and difficulty swallowing. When the risk of metastasis through cervical lymph nodes is probable, your client would undergo a radical neck dissection. What would your preoperative nursing care consist of? Prepare your client and his family for vocal changes or loss of normal speech. Discuss postoperative communication measures. Prepare for permanent tracheostomy and prepare for alterations in appearance. As with any procedure, there is a potential for complications. What complications will you be monitoring for? Poor wound healing, infection, bleeding, airway obstruction, and tracheostomy stenosis. For the sake of today's discussion, your client has not experienced any complications. What would your postoperative nursing care include? You'll provide tracheostomy care, suctioning to maintain the client's airway, tube feedings, and alternative communication measures, such as a magic slate. Care would include pain management, positioning to promote ventilation and comfort, oxygen therapy, support for speech therapy, a medical alert bracelet indicating permanent tracheostomy, and of course, emotional support. We'll wrap up this overview of laryngeal cancer by looking at the nursing considerations. Prepare the client and family for diagnostic and therapeutic procedures. Monitor and maintain adequate nutrition and hydration. Promote adequate rest. Provide for comfort and pain relief. Refer the client and family to a cancer support group. Support options for palliative care. Let's review the care of a client with a chest tube. Because a client who has a lobectomy will have a chest tube postoperatively. First, remember why someone might need a chest tube. We've already mentioned two reasons: trauma and surgery. Others include blunt trauma to the chest, spontaneous pneumothorax, and thoracic procedures like thoracentesis when complications develop. Signs and symptoms indicating a need for a chest tube would be air hunger, agitation, hypotension, tachycardia, diaphoresis, absent or diminished breath sounds, tracheal deviation, and cyanosis. Now, let's talk about your role. You'd set up the chest tube's drainage system and assist the physician with the insertion procedure. This involves keeping the tubing loosely coiled and free of kinks, teaching the client not to lie on the tubing, taping all the connections to keep them from coming apart, milking or stripping the chest tube, only if ordered, to increase negative pressure in the pleural space, making sure the chest tube is not elevated above the client's chest. Never clamping the chest tube. making sure the airtight seal is maintained around the insertion site, and encouraging the client to cough and deep breathe. Because the chest tube is inserted to remove air and serosanguinous fluid from the pleural space, it is important to monitor the amount of drainage, to watch for fluctuation in the chest tube, to assess breath sounds, to monitor the insertion site for signs of an infection, and to provide pain medication as needed when the chest tube is in place and after removal. The most common drainage system you'll see used with chest tubes is a commercial, disposable, single-unit, 3-chamber system like the Pleurovac. Each chamber has a specific function: collection of drainage, water seal, or suction control. The collection chamber collects drainage from the lung, such as blood from a hemothorax. The drainage must be measured and documented. This is usually accomplished by placing tape on the exterior of the chamber and marking the level with the date and time. As the client's condition improves, the drainage decreases and the color lightens. Water is added to the water seal chamber up to the 2-centimeter level. This lets air exit the lung, thus allowing for re-expansion, but keeps air from re-entering the lung. Air leaving the pleural space is observed as bubbling in the water seal chamber. The fluid level in the water seal chamber fluctuates with respirations, and that movement is called tidling. This activity indicates that the system is functioning properly and that the tubes are patent. The cessation of bubbling for 2 to 3 days is an indication that the lung is probably re-expanded. The third chamber is the suction chamber. Suction is regulated by the height of the fluid, as prescribed by the physician. The suction chamber is connected to wall suction and set to achieve a slow, gentle bubbling. Although chest tubes are often inserted in the emergency department or at the bedside, this client will have his inserted in the operating room during his surgical procedure. Shall we review the parts of a trach tube as well as general care? A tracheostomy might be necessary any time a client's airway is obstructed. The obstruction can be from a variety of things, such as a foreign object, aspiration of stomach contents, upper airway bleeding, cancer of the larynx, tracheal tumors or strictures, an enlarged thyroid, oropharyngeal or mediastinal tumors, laryngeal edema, epiglottitis, or prolonged mechanical ventilation.